Hi Cami, my name is Lindsay. I'm going to be your provider today. Can you verify your name and date of birth for me?
Yeah, Kathy Stuckey, 51788.
All right, beautiful. So I'm going to do a health assessment on you. I'm going to start with your cardiac, and please tell me a little bit about your history. Any chronic cough, any chest pain, palpitations, difficulty laying flat?
No cardiac history.
All right, perfect. Any history of coronary artery disease, diabetes? Any history of family history of sudden death?
Nope.
All right, beautiful. So next I'm just going to inspect your neck. I'm just going to look at your jugular here, and I'm looking to see if there's any pulsatile or anything here, and I see nothing, which is perfect. Also just going to inspect on both sides. Great, and then I'm going to look at your chest and your precordium. I'm just looking for any pulsatile areas, and I see nothing. There's no concavement. Your respirations are equal and symmetrical. Beautiful. All right, Cami, now I'm just going to palpate each area in your neck. I'm just feeling your carotids here on this side. Beautiful. And I'm feeling on this side. Your pulse is nice and strong on both sides. I'm next feeling for your apical pulse here. Now, can you exhale for me? Beautiful. It's in the appropriate location. One finger tip width. Great. And now I'm just going to put some pressure right under your rib cage here.
Okay.
All right, and I'm looking at your neck, and I'm going to release, and I see your neck deflate there for me, so that's perfect. Thank you. All right, Cami, now I'm just going to listen to your heart sounds. First, starting on the right, second intercostal space, moving over to the left, second intercostal space, moving down to your fourth intercostal space on the left, and lastly to the fifth intercostal space, also on your left. Heart is strong, rate is regular. Perfect. And I heard no murmurs with my diaphragm. I'm now going to listen with my bell to see if I can hear any extra heart sounds. I hear no extra heart sounds, which is good. If I were to hear anything, so if I were to hear a murmur, or any regurgitation or stenosis. So stenosis is narrowing. I heard none of that. Regurgitation is if you have an insufficient pelvic, and I also heard none of that. So everything is good. All right, Cami, we're going to walk into the peripheral vascular aspect of your health assessment now. I'm just going to ask you some questions regarding your history. Any history of edema in any of your extremities?
Nope.
Redness? Any pain with walking or claudication?
Nope, not today.
Okay, not today. Wonderful. So next I'm just going to inspect your skin here. I'm looking at both your extremities. They look good. Your skin is warm. You have good turgor. I'm just going to check your pulse. First I'm going to check your radial, which is on the thumb side, and then your brachial, which is on your ulnar side, and they're both a +2. Okay, and I'm going to do the same over here. +2. +2. Next, I'm going to assess for any carotid bruits. It's indicative after a coronary artery disease if you develop a bruit, so I'm going to listen with my bell. Same with my bell here. Very good. Next, I'm just going to check your capillary refill. So I'm just going to squeeze your finger, and then hopefully it will blanch, and then your color will come back within 2 seconds. So perfect. Check over here. Perfect. And then also looking for clubbing, which I don't see, but clubbing would be a downward sloping of your nails and then kind of a widening on your finger base. Sometimes that can happen with COPD or a smoker after many years, but you're young, you're healthy, you're not a smoker. So that's wonderful. Thank you. All right, Cami, now we're going to go down to your lowers, and I'm just going to assess your skin down here.
Okay.
Any itchiness, redness, dryness, anything of concern down here, any swelling? Nope, your skin looks good, just as healthy as up on your top. I'm just going to check your circumference of your calves here. They should be less than a centimeter in difference. Beautiful, they're equal. I'm also going to check for a Holman sign, so that would be indicative of a DVT, so we'll flex that up. Any pain?
No pain.
And then I'm also going to check over here. Any pain?
No pain.
Perfect. And then I'm just going to check your pulses. You seem very warm and you're able to move with no pain, so I'm sure they're fine, but I'm just going to double check. So we're checking your femoral, +2, your popliteal, and popliteal, +2, Alright, Tammy, your skin is looking good. Always ensure that you seek medical attention if you have any unilateral leg swelling or any pain in your calf. Okay?
Thank you.
Yep, thanks. Alright, Tammy, now we're going to move into the respiratory portion of your exam. So first I'm going to find your suprasternal notch, which is right up here. I would identify any retractions there, any concavement. Everything looks symmetrical on you. And then I move down to your sternal notch. And I identified that. Perfect. Can you take a couple deep breaths for me? Beautiful. Nice and symmetrical. I'm just going to percuss here. And we have resonant sound, which is good. Beautiful. And now I'm just going to listen for one full breath for each lung field. Listening with my diaphragm. Deep breath for me. Very good. One. Good. Here. One. Beautiful. And now I'm just going to come around to your back. I'm going to put my hands on your back just like this, and I'm going to have you take a deep breath. Deep breath for me. Perfect. So that was about 2 inches that my hands moved. That was symmetrical movement. So next I'm just going to percuss back here, identify your lung fields. Again, resonant sound. Beautiful. And I'm just going to listen to each of your lung fields from behind. Listening with the diaphragm. I'm going to have you take one full breath each time. And inhale. Perfect. Just going in a ladder motion across. Perfect. And just a couple more. Perfect. And now I'm going to do some extra tests for you. So I'm going to listen to your lung fields again, just like that. Each time I'm going to have you say something different. First, we're going to start out with having you say E. This will help me identify any consolidation. Okay.
E.
Again.
E.
Again.
E.
Again.
E.
One more time.
E.
And last time.
E.
Perfect. And this next time, I'm going to have you whisper. 1, 2, 3.
Okay.
Okay.
1, 2, 3.
And then whisper for me.
1, 2, 3.
Okay.
1, 2, 3. 1, 2, 3.
And again.
1, 2, 3.
And again.
1, 2, 3.
Okay. And for this last exam, I'm going to have you say 99.
Okay. 99.
Again.
99.
Again.
99.
All right, Tammy, now we're going to do the neural part of your exam. Can you just tell me the person, your name, the place, and the time?
Yeah, my name is Cami. We're at the hospital, and it is 9 o'clock p.m.
All right, perfect. So now I'm going to do an exam. After I've examined your head, your eyes, your ears, your nose, your throat, I'm going to go on to examine your cranial nerves. So first I'm going to do 3, 4, and 6. So if you can just keep your head nice and still and just follow my finger with your eyes. All right, very good. So next I'm going to test cranial nerve 5. I'm going to have you clench your teeth for me. I'm going to put my hands right here. And then I'll have you close your eyes, and I'll touch you with either a sharp or a dull object, and you tell me which it is, okay?
Okay.
So I'll have you close your eyes, and then clench your teeth. Now is this sharp or dull?
Sharp.
Okay. And how about over here? Sharp or dull?
Sharp.
Perfect. And one more time over here.
Dull.
Perfect. Great. And then our next cranial nerve that we're going to do is cranial nerve 7. So what I'll have you do is I'm going to have you close your eyes and then raise your eyebrows.
Okay.
And then raise your eyebrows. Perfect. Perfect. And what I'm going to have you do next is cranial nerve 8. And that's really auditory. We've been talking this entire time, and you've been doing great, but I'll just do an extra test here. So what I'll have you do is just please include whatever ear I'm not speaking into. So I'll have you include that ear, blocking out the sound like an earplug. I'm going to whisper an object or a name into your ear, and I'll have you tell me what it is.
Baseball.
Perfect.
Watermelon.
Perfect, perfect. So next, what I would do is test your glossopharyngeal nerve, which is your gag reflex. However, I'm not going to make you gag in the office today. After that, I'm going to test cranial nerve 11, and I'll have you shrug your shoulders and try to, I'm going to push down and just try to push up against it. All right, perfect. And then next, I am going to test cranial nerve 12, so I'll have you stick out your tongue. It's midline, and can you go from right to left? Perfect, wonderful. And then next here, I'm just going to test your sensation. So have you close your eyes again for me. And then tell me if this is sharp or dull. I'll have you, flip your palms up. Perfect. And then sharp or dull?
Dull.
Okay.
Dull.
Okay.
Sharp.
Perfect. And then I'm going to go right down here onto your calf, so no surprises.
Sharp.
Okay.
Sharp.
All right, perfect. And then I'll have you keep your eyes closed, and I'm going to test your position sense. Just tell me if I'm moving your finger up or down.
Okay.
And
Up.
okay.
Down.
Okay. I'm just going to do this other hand just for kicks.
Up.
Okay.
Down.
All right. Perfect. That concludes our neuro exam. Everything looks really well with you today, and I look forward to seeing you in the office.